engagement, and we just want to thank you for being here. One thing I'd like to say is that recently we met with a couple of faith-based community leaders in the community, and we had a discussion where we talked about the millage and what we wanted to do and had planned to do. And one of the things that they stated was that instead of, because we did tell them that we did do a Zoom town hall meeting, and they said, you need to bring it to the people. You need to bring it to the community. So we listened, and that's why we're here today. Even with COVID-19, we're doing the social distancing, but one thing that GHS is good about is that we do listen and we try to do better. So that is why we're here today. We want to be very transparent about what we hope to do when the millage passes. And also what we have been doing. We've been around for over 50 years, and we have always listened to the needs of the people. So at this time, for opening remarks, I'd like to introduce Dr. Lawrence Reynolds, who's a Flint pediatrician and also the health advisor to the Flint Mayor, Sheldon Neely.
Well, good evening, everybody. And yes, I am a pediatrician. And the 29 years that I have been in Genesee County, I have worked either in partnership or collaborating with Genesee Health System. And every time the millage comes up, I support the millage, because across the life course of every child, every family that I take care of, at some point, some of them are going to need the services that are offered. And so people think it's just seeing the psychiatrist or the social worker or getting medication. It's more than that. It's addressing the physical health as well as the mental health and providing that integrated care. And I appreciate the commitment over the 29 years I've been here that I can talk about. I appreciate that commitment and the openness for service for everybody at any time. So thank you.
At this time, we'll have our CEO, Mr. Dan Russell, to talk about the millage.
Thank you, Dexter, and Dr. Reynolds, thank you. You're a tough act to follow, but I will try. So I want to thank everybody for coming, and I'm going to be real brief. I just want to tell you why GHS is doing a millage at this time. And I do know that it's not a great time to pay more taxes. Nobody likes to do that. I don't like to do that. But I think at this time, we are seeing an increased need for services that our usual funding does not cover. Medicaid is a great benefit. Unfortunately, we're starting to see an increasing number of people, and this was pre-pandemic, that did not qualify for Medicaid and were having trouble finding that funding to fill in those holes. During the pandemic, that has just continued to increase, and we know that's going to just explode once the pandemic kind of levels off. So we're looking for some flexible funding to fill in areas where we see that increasing need. And you'll hear more about the specific areas, but crisis services, working with police, and being able to provide more services in school. It's not a lot of money, it's pennies a day, and my personal feeling is it's a pretty good return on investment for the community. So if this millage passes, I guarantee you that the community will be a better, a safer place to live and work. So thank you.
At this time, I'd like to introduce two of our presenters that will be presenting on the services and how the millage will fund the different services. We have Angela Tyler, Strategic Initiatives Project Manager for Genesee Health System, and also Sean Edwards, Senior Director of Diversity and Inclusion. So at this time, we'll have them come up, and they will go over the different areas and services that will be covered.
first area, there are 7 total areas that we want to focus on if the millage passes. And I'm going to talk to you a little bit about the first area. Excuse me, I'm not used to speaking with a mask on. So the first area is law enforcement, first responders, and our crisis intervention team. The Crisis Intervention Team program, we call it CIT, is a community partnership of police officers, mental health providers, and social service agencies, and people affected by mental illness. In over 2,700 communities nationwide, there are CIT programs active and involved, and they create these connections. This program is designed to help people with mental illness and or addictions get treatment instead of going to jail because of the behaviors caused by their illness. The training promotes officer safety and safety of the person in crisis, so everyone leaves the situation as safely as possible. I think this is something that is not unknown to us as a community and what we've seen nationwide. The CIT program in Genesee County is currently in the planning stage. In 2020, we received a federal grant through SAMHSA to begin that process. It will partially fund the community planning as well as pay for the initial hiring of a CIT coordinator. No traditional funding sources exist currently to fully pay for these efforts beyond the grant period, which will end in 2022. We don't want people with mental health issues going to jail just because there is no other option. Millage funding would allow for the CIT program to be fully funded and continue. A CIT coordinator here in Genesee County would make sure that officers are trained for 40 hours that initial training and then additionally for booster trainings. The other way that the millage would fund CIT is it can release the burden from a lot of local police departments. We know that they're stretched thin, and this millage would help ensure that every officer in Genesee County every CIT officer in Genesee County is trained, and that our goal would be to have a CIT trained officer for every shift. The next focus area is law enforcement and mental health co-response and jail diversion. As I touched on briefly about CIT and the need for people with mental health issues to not just go to jail because it's a convenient thing to do. Right now, as it stands, those suffering mental health challenges face either going to an emergency department or the local jail when they come into contact with law enforcement. We all know these are not the best options for people in crisis. Currently, there aren't very many options to address those behavioral health needs 24 hours a day in the field. So what this millage would do is allow us to divert people from jail and emergency rooms by having mental health professionals to work together with officers in a co-response model available 24 hours a day, 7 days a week, 365 days a year. A mental health professional would provide consultation and support to both officers and those whom they come in contact with who may be experiencing a mental health crisis. Additionally, the millage would take the burden off of the local police department budgets as they send officers to the initial 40-hour training and additional booster training. Crisis de-escalation would be the primary goal to allow for a safe outcome for everyone while connecting them to treatment at the end of the encounter.
Thank you, Angela. Thank you for all attending and being interested in what we're trying to do at Genesee Health System in the passage of the millage. So focus area number 3, Angela mentioned that there are 7 focus areas. The third focus area is on court, corrections, mental health supports, and services. Currently, Genesee County Community Mental Health has a mental health court, and we have graduates with very great improved outcomes. Some of the outcomes are higher employment status, educational level advancement, better quality of life, mental health improvement, compliance with medication. And if we have a millage passing, guess what? We'll have be able to do more. We'll continue our mental health court beyond grant funding. That's very important. So program sustainability. We will be able to provide expanded services for those who are uninsured or underinsured. Also, reduce incidents of negative impacts on the community and assist with pro-social integration into the community. Focus area number 3. Focus area number 4, we have suicide and crisis prevention. Currently, we're raising awareness, reducing stigma, We have outreach services to those who are experiencing suicidal thoughts, and we provide education to individuals who are able to help other individuals. So we have a Living Works Start program and a QPR program, Question, Persuade, Refer. It's all about helping individuals who are considering suicide. We have a faith-based outreach, and what we'll be able to do, if we have a millage passing, we will be able to mobilize partners to communicate a county-wide emergency plan. We'll increase training opportunities to strengthen our community and enhance suicide-specific data collection and certain systems. Focus area number 5, prevention and crisis de-escalation in the K through 12 community. What we do now. Currently, we're providing mental health first aid education to those who work with people, humans in general. So we want to educate more. We have an infant and early childhood consultation, mental health mobile units, as you can see in our parking lot. We have an outreach team, great outreach team, who works on mental health awareness, prevention, intervention, and postvention. What we could do, if the millage passes, is have an increased presence within our schools. Very necessary. We would also be able to create liaisons and consultant work with programs, and we would be able to identify students who need support. Very, very important. And expand eligibility criteria for those who are receiving services.
Thank you. And the final, or not the final area, the 6th area that I want to talk to you about is the Crisis Center Crisis Stabilization. Genesee County does not currently have a place outside of an emergency department available for people experiencing urgent or emergent mental health needs. Local emergency departments do their best to manage these patients. However, they don't have staff available with the expertise to treat people in acute crisis or with urgent mental health needs, and they are limited in space with emergency medical issues taking priority. Before the pandemic, GHS was discussing a partnership with Hurley for a physical location to provide these services. We were in the planning stages, but the pandemic placed these efforts on hold, as both funding and staff priority went where it was needed most to help during the pandemic. Keep in mind, traditional funding sources don't fully fund the creation of a physical space and the staff needed to provide these kinds of services. It is our goal to create a space where anyone in Genesee County can come with urgent or emergent behavioral health needs to receive the care they need and be connected to long-term treatment. And we hope that that can happen regardless of insurance, whether you're having, what type of insurance you have, or if you have any at all. If a person needs to see a mental health clinician or medical staff for a psychiatric evaluation right away, the Crisis Center would be available to them. We also refer to it as our behavioral health urgent care. If the millage were to pass, these funds would allow for a physical location to be established that can accept all comers, regardless of what insurance you have, as I stated previously. Staff would be available 24 hours a day, 7 days a week, and 365 days a year to provide assessment, treatment, and crisis stabilization with a goal to resolve the immediate crisis at hand. And I think you can see the recurring theme of some of these target areas is 24 hours a day, 7 days a week, 365 days a year. Because we all know that crises are never happen at a convenient time in the middle of the day, 8 to 5. Finally, I'd like to bring your attention back to the first 2 focus areas at the beginning of this presentation. I spoke about the need for people with urgent mental health concerns who interact with law enforcement to have a safe place to come and receive treatment from mental health professionals in a timely manner. The behavioral health urgent care is that place as opposed to an emergency department with long waits where people with medical emergencies need to come first, and providers don't specialize in mental health treatment. We don't want people who have mental health needs to go to an emergency department when they don't need to just because it's the only option.
And our final focus area number 7, health and wellness for vulnerable populations. What we're currently doing, we're providing an array of mental health treatment services Examples of those would be evidence-based practice therapies, medication clinics, community living supports, integrated health care, which means physical and mental health care together to treat and work with the whole person, case management linking to housing, nutrition, transportation, insurance, and so forth. We're currently providing outreach services and peer support services. What we could do, this is our hope, to expand these services, implement new innovative services, that's always our goal, and bridge the gap for individuals and families in need who don't currently meet funding criteria. So we would hope that our millage is successful. We're relying on everyone in the community to work with the entire community. We're very resilient. I would like to now pass it over to David Lawson, and thank you.
Thank you, Sean, and thank you for everybody for coming out tonight. My name is David Lawson, President of Evergreen Public Relations, here with my colleague this evening, Beth Bowen, and we've been working with Genesee Health System for months, and it feels really strange to see everybody tonight in person because of the pandemic. So in better times, we would have been indoors, I'm sure, with a lot more folks, but glad that you're here this evening. One of the things we did initially when we started working with Dan and his colleagues about this is try to gauge public support. So we did a poll with Dental Research back in March. We had 300 completed responses of 90. Our target audience were those that were likely voters who were absentee voters, and in Genesee County there's 96,000 of them right now. And so we have some results that we wanted to share with you when we did this poll last month. And before we did any messaging about what the millage was going to include, we just asked a general question: would you support a mental health millage? And 76% of the respondents said yes, they would, without even really knowing what was going to be included in it. And this was before we did any of the direct mail, we've done any of the social media and paid advertising and bus wraps and billboards. But as we kind of dove into it and explained, especially what Sean and Angela mentioned with the collaboration with law enforcement, when we informed those voters that there was going to be collaboration with law enforcement to help with de-escalation, that number jumped up to 84% of the respondents said yes, they would support it. When they found out that there would be a crisis intervention center itself, that number stayed at 81% of support. And then finally we asked, after we did all the messaging, do you still support the millage? And it still hovered at 81% said yes, they support the millage. One of the things we did towards the end of the poll is we just asked individuals, for those who said yes, they support it, or no, they don't support it, just tell us why. We're just kind of curious. So these are statements in these 300 individuals from around the county in their very own words. So I'm just going to do an open quote for each one of them. The first one is, we can't leave people behind in our community. I'd rather see people get help rather than go to jail. It would relieve some of the tension on police dealing with personal crises. I have relatives who suffer from mental health challenges. I definitely understand the need for more services in our area. Mental health is just as important as physical health. I have a son who has mental health issues, so the issue is very close to home for me. There's hardly anything out there to help people who are suicidal. And finally, the state of Michigan should pay for this. So those were some of the initial responses. But as we have done, Dan and I, since February, have done about 30 of these presentations around the county. Over Zoom, I might tell you. The biggest question we always get from folks is, what's this going to cost me as a taxpayer? So if you go home this evening and look up your tax bill on your property, there's going to be two numbers on there. One, the assessed value, and that's what the assessor puts on the value of your house, and then the taxable value. And so the figure we want to use here is the taxable value of your house. And everything's always different because it's about the size of your house, the square footage, how many bedrooms, bathrooms, garage, do you have a deck in the back? A whole bunch of calculations come together. But if the taxable value of your house is, say, $25,000, the tax per year for you as a homeowner is $23.50. or 6 cents a day. If the taxable value is $50,000, the tax per year is $47, or just 12 cents a day. Or if it's $200,000, the tax per year is $188 a year, or 51 cents a day. My wife and I, we live in Linden. We're right around the $47 a year for taxes, though that is going to go up because we're siding our house right now. Today's day number 8 of the siding job, so I know my assessment's going to go up, but to me, that's an investment I'm willing to make to help my neighbors out who are suffering from these issues because of the pandemic. But as we have done these presentations, we have garnered a lot of political and community support. So Congressman Dan Kildee supports us, both state senators Jim Ananick and Ken Horn, bipartisan support in the state legislature, State Rep Tim Sneller and John Cherry. 2 new county commissioners, Charles Winfrey and Dominique Clemens, are supportive. Our very own Dr. Reynolds, who's here this evening, thank you, sir, for your support, as well as his colleague, Dr. Mona Hanna-Atisha, and Dr. Jennifer Johnson from MSU as well. And then we have a broad-based community support. The Greater Flint Health Coalition, Genesee County Medical Society, the Genesee County Superintendents Association, and the Genesee County Prevention Coalition. So we have been doing a lot of outreach over the last 2.5 months to build broad-based support for this millage. So that is our presentation tonight. With that, I'm going to turn it back over to Dexter. If there's any questions that we may have from the audience that our panel of experts or Dan or Dr. Reynolds might be able to answer. Thank you.
Do we have any questions on any of the information that was presented by our presenters? Yes.
Also, you mentioned there being 300 responses to the poll. Do you have an idea of maybe the area or demographics or breakdown of who actually responded to the poll? Hi, Dr. Reynolds.
Yes. Thank you, Dexter. Yes, so it was a random sample of 96,000 individuals. I believe 12% of those respondents were City of Flint residents, and the rest were scattered throughout the county. And so we wanted to make sure we had a representative sample of all the voters. So it was a random sample that Deno Research did for us back in March. But we can definitely share some of the breakout information with you later on if you'd like.
Yes, always.
Are there any other questions? Yes.
So to make sure that I've understood correctly, so really you are sharing information to make sure that community constituents and residents have understanding of what this millage would comprise and what you would do with the millage. I think this might be more micro than what the intention is for today, right? My position is that oftentimes we have resources that come into community, but the folks who reside in those communities don't actually know how to navigate the resources. And so my interest in terms of what will happen with this millage is, how is there a strategic plan or consideration for how people learn and how people interact with resources that is embedded into your approach for rolling out whatever services you intend to provide through this millage? And how can someone like myself be informed of what your progress is to going through that plan, and what data you've been able to collect to show that your approach, I know these are a lot of questions, I do this a lot, but to show that your approach is actually useful to the priority individuals that you seek to serve.
Okay, thank you for all of that. I think those are real good questions, and I think very legitimate concerns. If this millage passes, we are going to set up a number of community groups to tell us. Since this is flexible funding, it kind of frees us up from some of the normal regulations that we have with Medicaid, which are voluminous. So we can kind of ask people, what do you want, instead of saying, this is what Medicaid pays for and this is what you're going to get. When we do this presentation, we say the budgets listed are educated guesses, and when we actually get to the point and we ask the groups involved, is this what you need now? They may change. So we intend to do that. We intend to go into the schools. We did meet with the Genesee County School Counselors Association. We will go back to them and say, okay, what do you need now? What are you seeing in the schools that we can help you with? We will continue to do that with law enforcement. We already have, as you heard, a CIT group together that will...
CIT? What does that stand for?
Crisis Intervention Teams.
Oh, okay.
So those are behavioral health professionals that work with police and train them to deal with mental health issues that they come across that are not criminal. So we'll keep working with law enforcement and say, what do you need now? And through every area we will go through that. So there will be multiple opportunities. And plus, there is the default to all this is we are a public institution. If you don't like something I'm doing, you come to my board meeting and you tell my bosses, say, hey, he said he was going to do this and he's not doing that. There's always that possibility. There's a lot of room for input, and we try and be very, very transparent. Does that kind of answer?
Part of it. I have follow-ups, but I'll pin in case anyone else has questions.
Keep going.
Okay, so board meetings. When are your board meetings, and how would one access the information to attend?
Okay, board meetings are usually the fourth Thursday of the month at 4 o'clock. And if you go to our website, genhs.org, the schedule will be there. And there would be information on how to access the Zoom. We do them by Zoom. And there are other committee meetings during the month, but the board meeting is at 4 o'clock, usually the last Thursday, depending on how the dates fall.
Thank you. Last question, probably a multi-part, and then I'll pin any future questions.
Okay.
So you mentioned that there will be many community groups that you'd be either engaging with or formed. I wasn't clear of which. I'm interested to understand, aside from the group of the school counselors that you met with prior to producing this millage proposal, what information did you gather that suggested that the resources that are being offered and the way they're being offered are actually desired and most useful to the folks that it is that you'll be serving? And then two, what rooms or groups are you already engaged with, independent of any groups that you might seek to form? For example, currently, GHS engages with the Genesee County Continuum of Care, which is the federally mandated group for anyone who is dealing with any organization who's receiving certain funds to deal with homelessness, your shelters and things of that sort. Currently, GHS being the large institution that it is, has one branch that's attending. You have your Bill Daw from the housing, I think it is. You would know better than me, right? But when you look at the population of individuals who are experiencing homelessness, right? A lot of times these are individuals who have a lot of mental health needs as well. However, our systems and organizations aren't set up to support them. So my position is I wonder if there's any feasibility of further engagement from GHS. But from that thought, it makes me think, well, where else are you all engaging in terms of community groups right now? And how is there an assurance that the community groups that you're engaging with have a diverse realm of constituents? For example, in this beautiful town hall meeting set up today, right? I was able to count when I came in how many brown people were here, and I'm sure that's not for lack of trying. And so that's my lots of stuff. I went on my soapbox. My question again: where are you engaging? Is there feasibility of more significant engagement with the Genesee County Continuum of Care? What data did you collect prior to producing this millage and coming up with these programs that suggested that this is actually what people are looking for? And who did you ask, and how did you ensure that it was a diverse sample of stakeholders? Okay. That is a lot.
I'll try and answer some of the questions as I remember them.
Yes, sir.
I think the one category that talks about vulnerable populations, I think that is mostly homeless. And that's kind of vague, because I don't know that we know exactly what the needs are. But I do know that we don't do a very good job. There's always a need there, and it's always usually about money. And so I think that's a pot of money that's going to get used and be available for lots of different things. How many brown people are there here? How many did you count?
What'd you say?
How many brown people are there? Did you count?
Let's see. 1, 2, 3, 4, 5, 6, 7. I
Okay.
counted 7.
Well, as we said, as Dexter, I think, said, we are here because one of the faith-based groups said we needed to be in person somewhere in North Flint. So that's why we're here. We asked, we listened, and we're going to do that. So we will continue to do that. I think this money is something that will help the community, that will be formed by the community. Now, we have some ideas because we've been doing this a while. But again, we can break some of the rules that we usually have to follow if this millage passes, and we have flexible dollars that we can spend if groups tell us we need to do this, or we need to do that. So again, they're placeholders. We have some ideas, but there's going to be a lot of room for community input and tell us, what are we missing?
Thank you.
Thank you. Great questions.
Are there any other questions? Okay. Okay. Again, we want to thank you. I know, Mr. Russell, if you want to wrap up or do a thank you. Okay, I'll take us out then. We want to thank you all for coming here. And as Mr. Russell said, as our presenters, Angela and also Sean said, we are here for the community, and we do better when we know what to do. So we're asking for your community involvement, and we're here, and we're not going anywhere. So again, we thank you all for coming out. We hope that you will support the millage. We hope that you will spread the word and let them know that this is a very needed millage for this community. And once again, like I said, thank you for coming. Yes, Dr. Lawrence.